What's very interesting is we never know what we will see.
Mgongo inauma na tarajia tasaidika siku ya leo.
Mwili yangu haikuangi sawa kabisa. Niko na uhakika nitatibiwa leo,
Na ninajua nikija hapa nitatibiwa vizuri nipone. Haki mmefanya mzuri juu kuna maprogram mengi. Hatupatangi maternity kama hii.
What we've learned over the years of doing the camp is how to keep on improving. So workflow is extremely important. So now take a tour of the medical camp with one of the students that's here and just see how the camp is run.
So once our patients come through the gates and they enter the camp, licensure then hands out the cards. And then once they're given those cards, they wait in the waiting area. While the patients are waiting, they fill out their card right here with their name and their telephone number and all their info. And then once they do that, they're then going to head over to this area where the registration desk is behind me. They're then going to be asked a few general questions. That's all going to be filled out here by our people in the orange vest. And these same papers that you see that are given at registration are then taken to the camp where doctors and students are using to work on.
Registration is where patients begin, and it's important for us to get our numbers correct. And the registration depends upon the number of clinicians that we have.
So right behind me is going to be triage, where we get the basic necessities of our patients. That's going to be the heart rate and the blood pressures of our patients. The history, we do the chief complaints and concerns of our patients, and then we end off with weighing our patients, and then we send them into the camp.
The triage team to me is one of the most important teams that we have, and we have multiple people working in triage. Their presenting complaint and the history of the presenting complaint needs to be pretty accurate.
Once our patients leave the triage unit, this is where they come and they're seen by different physicians of different specialties and also students like myself that you see in blue scrub. We're helping along when we're learning. Personally, I'm in sonography and EKG/ECG.
So being directed to the correct specialist is very important, and that helps us with workflow. The clinicians work at different rates and see patients at a different pace. So it's really important we work as a team and help each other out. So this way, the momentum continues and we're able to see a vast number of patients.
Lastly, standing here behind me is going to be our pharmacy. As you can see, there's lots of assistants, students, and physicians here. They give out the medicine that's prescribed to and referred to by our doctors in the camp. Our patients typically wait outside and it is given to the window right here. Their name is called and the prescription is given. It's all sorted and given out on these tables right here behind me.
So everything from registration through to triage and for patients to be sent into the right area, that workflow is extremely important for us to continue with the momentum. And that way we're able to maximize the number of patients that we can see due to efficiency. I think of it as almost like a supply chain management thing.
So being Kenya in Kenya for the first time is a play on words, but it's actually true. My name is Kenya, and I get to do one of the things I love the most, which is help out the community and give back.
We want to serve every single patient to the best of our ability with whatever their needs may be. Please do continue in watching our videos and discover the type of patients that we get to see.